The first thing that you need to do when you have an order for a Mini BAL is to check the order, because in it, it's going to specify whether you're going to access the left or the right lung. You then want to check the platelets. Just the nature of this procedure, you're going down into the lung with a suction catheter, so it can cause bleeding. You want to make sure that the platelets are at least 50,000. If they are below 50,000, you need to let the physician know. The physician may tell you to proceed with the procedure regardless. If that's the case, just make a simple progress note. After you check that, you want to get with the nurse, and if they are on 2 feeds, you want to make sure the 2 feeds are off for at least 30 minutes prior to the procedure. You then want to check the ventilator settings. If they are in a rate below 10, you want to turn it up to at least 10, and then you want to put them on 100% for at least 10 minutes before your procedure. And then we'll keep them on 100% throughout the procedure. Then you want to go ahead and gather your supplies. You need a second RT, because one of them always needs to be sterile throughout the procedure. You want to go ahead and grab some Chuck's pads for the patient's chest. You want to get the kit itself, your normal saline with your IV access adapter, 3 20cc syringes, a Lukens trap, and then your suction setup go into your wall, have it set on -80. Then you want your PPE, so your pair of gowns, mask with face shields, set of gloves, and then a set of sterile gloves. Once everybody is gowned up, then the non-sterile person will go ahead and open the pack, and in this pack you're going to see a bunch of stuff. Half of it we don't even need. All we're going to use is the catheter itself, the suction adapter, and then the ET adapter. These 3 things we don't need. The non-sterile person can then go ahead and spike your bag of normal saline and then pull up 20 cc's into each of your syringes. The sterile RT will then grab the catheter and the ET adapter. We're going to remove this little plastic piece, and we are going to insert the tip of the catheter into the adapter. Notice this locking mechanism here. You want it pushed up this way. It's not going to fit otherwise. So go ahead and thread this through and have it sticking out about 1 centimeter or so. This is going to make it easier to get the catheter into the ET tube. On the other end, the non-sterile RT can grab the suction adapter, attach it to the end here. We can hook up our Lukens trap and then attach that to our suction, and again you want to have it set on -80. Make note of the 3-way here. It points to the port that is off, so you want to have it pointed towards the suction. That way it's off while you're preparing and advancing the catheter. Also make note of this port here. This is an oxygen port. That's what this tubing is used for. You can hook it up to here, hook it up to a flow meter to instill extra oxygen. Not really necessary in most cases, because we have our patients on 100% anyways during the procedure. So we're going to go ahead and say that we're going to access the left lung. This little port here is also helpful because it always is on the side that the catheter is curving towards, so it helps keep you oriented as you're advancing this down the airway. So once you are ready, the non-sterile RT will go ahead and detach the circuit from the ET tube, and you're going to go ahead and insert this into the ET tube, doing your best not to break the sterility of the tip here. So I'm going to hook that up. The non-sterile RT is going to hook the circuit back up to the adapter here, And now we're gonna get ready to advance. Notice the markings on the catheter here. What we're gonna do first is we're gonna advance this and line up the markings here with the markings on the ET tube. So we're gonna go ahead and advance our catheter. We're gonna match up the 30 with the 30. And that way, the tip of our catheter is now at the tip of the ET tube. And notice how this has shifted to the right side. It's pretty common. So just go ahead and spin this back to the left. That way we're pointing towards the left side. Now from here, we're going to advance another 5 centimeters. That should put us into the main stem bronchus. So we're going to line up the 30 with the 35 there. And now at this point, we're going to advance our inner catheter 2 to 3 centimeters, or until you hit resistance. If you hit resistance, just stop there, back up 1 centimeter, and leave the catheter at that spot. So now we're gonna go in, we're gonna go to the 38, we'll call it 3. And then from here, you can go ahead and lock. Cut. The non-sterile RT will grab the syringe full of saline. They're gonna hook it onto the port here, and they will go ahead and flush. And at this point, you can retrieve your sample one of 2 ways. You can come to this port, this 3-way, you can flip it up towards the syringe. That's gonna initiate the suction, and that'll pull your sample into your Lukens trap. Alternatively, you can keep the suction off and then just pull back with your syringe. If this is one of those cases where the doc asked you to do the Mini BAL despite low platelets, I recommend doing the syringe method just because it's a little bit more gentle. If you push in 20 cc's and you are unable to aspirate anything or suction any sample out, you can detach this. You can try your second 20 cc syringe and still aspirate. If you're still unable, you can do it a 3rd time. But if you're unable to collect a sample after that 3rd syringe, then go ahead and let the physician know, and they'll tell you how to proceed. Once you are satisfied with your sample, then you're gonna go ahead and unlock. You're gonna pull back your inner catheter, pull back your outer catheter, detach, and then hook the vent back up. If your patient has a trach, the process is pretty much the same, just the measuring is going to be a little bit different. Obviously, your trach tube doesn't have centimeter markings like your ET tube does. So see what size trach your patient has, grab the box, and then look at the sizing on here. So you can see it says C equals 79 millimeters. So the length of the trach tube is 7.9 centimeters. I then pull up a chest x-ray and see how far the tip of the trach tube is from the carina. If this trach tube is about 8 centimeters long, let's say that the trach tube is about 6 from the carina, so we'll say 14 in total. You're gonna go ahead and attach, and then you're gonna advance your catheter. This part requires a little bit of eyeballing. You can see on here that the first marking we have on our catheter is 16 and we're trying to target 14. So what we're gonna do is we're gonna advance this to about what would be the 14 mark. The 8 centimeters of the trach tube is just the white part. It doesn't account for this clear part here. So we're gonna stop at the 14. You are then gonna advance your inner catheter another 2 to 3 centimeters like we would. We'll call it 3. And then you're gonna lock, attach your syringes, and still and aspirate.